Well, good afternoon and welcome to Freelance Business Week and the 3 p.m. Eastern Time session. I'm Kevin Bakewell and I'm excited to be your moderator for today's session. Let me just cover a couple of housekeeping things if I can. First of all, we're going to be handling questions via the chat feature. So please do take advantage of chat. You will need to scroll all the way down on your screen and you'll see the chat box down there, and you'll also see the history of chats from other folks who've entered their comments. So again, we'll be doing Q&A through the chat, likely trying to answer your questions throughout the presentations, or if not, we'll try to capture those at the end. Also want to encourage you as you're watching to give our presenter, Kathy Grant, an upvote so that she knows you appreciate her efforts, and certainly also be aware that these are all being recorded. So please feel free to either take advantage of the replay to watch it again, or certainly if you want to share that replay link with others. The replay comes up pretty quickly after the live presentation. And also, please do share links to those replays on your social network and put your comments out there on Facebook or LinkedIn or your social channel of choice. I'm very excited about our next presenter, and this is sort of the overriding theme for this conference is diversity, equity, and inclusion. And we just finished up a national diversity, equity, and inclusion panel, and I got to tell you, it was outstanding. So that's definitely one you want to go back and play if you were not able to join us live. Truly, what I would say is award-winning content. And speakers. So great presentation. But we're very excited here in Tampa to showcase one of our own. And I'm going to bring her in studio right now. Good afternoon, Kathy Grant. How are you today?
I'm doing well. Excited to be here. Thank you.
Great. Well, we're going to have a whole focus on diversity, equity, and inclusion with just one speaker as opposed to a panel. So let me just introduce Kathy. Kathy is the Senior Director of the Moffitt Diversity Team at Moffitt Cancer Center, the top cancer center in the state of Florida and the Southeast United States. Under her leadership, the Cancer Center has advanced to become a nationally recognized diversity and inclusion leader. Kathy leads an interdisciplinary team of diversity and inclusion professionals focused on diversity and inclusion, cultural and linguistic competence, supplier diversity, which is very important, health disparities, and community engagement. During Kathy's tenure, the Moffitt Cancer Center has ranked top 10 by Diversity Inc. on their annual list of top health and health systems for 4 consecutive years. She's recognized by the American Hospital Association as a healthcare equity honoree, and has been designated as a leader in LGBTQ healthcare equality for 9 consecutive years by the Human Rights Campaign, among many other accolades. Kathy's a graduate of City University of New York. New York's one of our Freelance Business Week partners this year. She earned a Master's of Public Administration. She's also earned a Certificate in Diversity Management and Healthcare from Georgetown University. She serves as a member of the Institute for Diversity and Health Equity at the American Leadership Council and is co-chair of the Governance Committee and member of the Tampa Museum of Art Board of Trustees. She is also a graduate of Leadership Tampa 2020. Kathy, we are delighted to have you, and I'm going to take myself off screen and start monitoring chat, and I'll pull up your presentation. So
thank you.
When you are.
Hello and good afternoon, everyone. Thank you so much for logging in today. I am really grateful to have the opportunity to share with you some of the things that I've learned over my 14 years at the Moffitt Cancer Center and another 10 plus years in banking and in higher education that has really been able to enable me to learn a lot more about how to advance diversity, equity, and inclusion programs within organizations of different forms or fashions. As Kevin said, I oversee a team of diversity, equity, and inclusion professionals. There are actually 23 of us, and focusing on all of those areas that Kevin mentioned earlier. But don't worry, what we're going to talk about today is in no way requiring such a large team. We've been at this work since 2003 under the leadership of Lee Green, who you may have had the opportunity to hear from in our previous panel session. And so I'm excited to share what we've learned. From a personal front, I consider myself a global citizen. I was born in London. My parents are from Guyana in South America, where I lived until I was elementary school age, and then I left, came to the United States, and went to school in New York City, completely public school education, which I'm really proud of. And just a weird fact about me, I started reading at the age of 3, although I didn't tell anyone because I like to be read to. So that was my preference. So today I want to, let's make sure I get this right. So I want to talk to you a little bit about the programs we have at the Moffitt Cancer Center to support diversity, equity, and inclusion, just to give you a little overview about that. And then I want to just go through 6 simple steps, or hopefully simple steps, that can help organizations understand how they can get going. When I start talking about the diversity and inclusion programs at Moffitt, oftentimes the audience gets a little overwhelmed, and they ask me, well, how do we get started? We don't have all of those resources. We have some volunteers. I'm just working to be an inclusive leader. How can I influence this in my sphere? One of the things that I will share is that I have no expertise in clinical care. I make no decisions about who we hire in terms of our leadership, or anyone other than those who report to me. I am paid to be a leader and an influencer, and I do that in a way that allows for collaboration throughout the organization, much like a freelancer would work to influence the direction of an organization. Or you may be a sole proprietor or a small business owner. This is not about necessarily going gangbusters, but it's about taking incremental steps on this journey. So my rules for today that I'd like to share with you is, this is a safe space. There are no questions that are unwelcomed. All questions are welcomed. I think respect is clear. Sometimes these conversations can be challenging, but we always want to make sure that we are respectful in our communications. Airplane mode means hopefully you can remove any distractions you may have. Disney means let's have a little fun. Sometimes these can be tense conversations, but we can still have a little fun learning from each other. And Vegas simply means that what we say here stays here, but what you learn can leave with you. So Moffitt Cancer Center was established in 1986. And it has a singular mission to contribute to the prevention and cure of cancer. And what I like to add to that, it's the prevention and cure of cancer for everyone. It was established by H. Lee Moffitt, who is still alive today, because he had 3 friends who were diagnosed with cancer, and they had nowhere in the state of Florida to go. As a Speaker of the House, he used his gravitas to move forward this effort, and we are pleased that Moffitt today is a top 15 hospital, as ranked by the U.S. News and World Report. We're the leading hospital in cancer care in the Southeast and in the state of Florida. As a both research and care provider, we are an NCI designated comprehensive cancer center, the only one within the state of Florida. We have approximately 7,000 team members, and we're amongst the most busy cancer centers nationally, seeing over 450,000 outpatients and screening visits within a single year. So during this period of time, we're working on our strategic plan, Impact 2028. We started this 2 years ago. It's a 10-year plan. And while that's exciting for me, and you'll see here that we have a real focus on patients first, what really attracts me about this is if you would pay attention to the red circle, is our values. And our values were defined about a year ago. And as the diversity and inclusion practitioner, I was so concerned that, oh no, maybe at the end of this, I'm going to have to go back and advocate to make sure that there is something related to equity included. This process meant that our team was focused on our team members identifying what the values of the organization would be. And I was so excited that inclusion was one of the 5 values that were identified: compassion, drive, excellence, imagination, and inclusion. And what that signaled to me was that our organization had really matured to the point where our team members understood what we were trying to accomplish, that equity, diversity, and inclusion were intended to be a fabric of our organization, the way we do business each and every day. So, what drives this for the Cancer Center? It's really just about our patients. And why it's important that we have equity and diversity and inclusivity in for our patients is because there is an unequal burden of cancer. Oftentimes people say that cancer doesn't discriminate. It actually does in some respects. And to illustrate that, I shared a couple of data points for you from Florida charts, which shows in the top charts the rate of incidence by race and ethnicities through our primary catchment area, these four counties you see listed, and the state of Florida. And as one would expect, the majority of the incidence rates are amongst those who identify as white. The next highest number is amongst those who identify as Black or African American, and third, those who identify as Latinx or Hispanic. But then when you start looking at the ability to survive and thrive uh, through cancer treatment, and you switch to mortality rates, there is a difference. And although African Americans do not have the highest rate of incidence, for some reason they have the highest rate of mortality in most of the counties you see listed and in the state of Florida, and this is for all cancers. And so it is our belief that if we do not understand and close the gap in the rate of cancer treatment and ability to survive, then we cannot achieve our mission, because we are not doing so for all members of our community. So that is what drives the Moffitt Cancer Center to focus on cancer health disparities. Now, I'm sure you're all from various industries, and if you took a moment to consider your industries, there's probably disparities we will find in all of them, whether it's housing, education. You might be in the grocery business, marketing, technology, fashion. There is difference in outcomes and abilities to engage in just about every industry you can consider. And when you understand this, you have the opportunity to make a decision about whether you would be apathetic to that, whether you would be sympathetic to it, or whether you're in a place to take action. And the ironic thing is, with all of these industries, regardless of where you work, there are economic impacts that are broad reaching for all community members. There are family impacts that are broad reaching. And if I could just put a pin in there is loss of innovation and talent. And one of the most recent such situations, particularly related to cancer, is around Mr. Chadwick Boseman. So if you think about the innovation loss, the fact that there are lots of Black and brown children and individuals around the world that appreciated his talent and his skill and the ability to be seen in a way that people of color often are not, that is something that we have lost because of an early, untimely death that could be very clearly tied to cancer health disparity. So that is our motivation for this work. So how do we approach it is around accelerating belonging, a combination of making sure that we are representative of our community at all levels of the organization, which for us is a challenge. Like many other organizations, the more senior, you have to be very purposeful and intentional about making sure that your governance structures and your senior leadership represent and reflect your community and your patients. Once we have this diverse group of people together, just working to make sure that everybody has the ability to contribute to the engine that Moffitt Cancer Center is, and working collaboratively and collectively in team science and providing care to patients in a way that allows for the best outcome for all of our patients. And Lastly, from an equity front, identifying disparities, such as those that we've talked about, promoting impartiality and providing access to opportunity, all combined in driving and accelerating belonging for our team members. So you might recall that earlier on, there was a sign on that slide that talked about our strategic plan that said patients first. And that is our focus, but we also recognize that in order to put our patients first, our team members have to have a good experience in the workplace. They have to feel that they belong. And so this first example shows it's a cross section of the different focus areas within our diversity and inclusion program, the people, the workplace, and the partnerships. And one example I would use is we have a team member engagement network known as employee resource groups and other organizations that focuses on the LGBTQ community. And that has really helped those team members who align themselves with that particular group or our allies to really get a good sense of belonging. But not only do we offer those kinds of opportunities, we also try to put policies in place to support them. And the example I would give is we have a very purposeful and well thought through policy on a team member who makes a decision to transition in the workplace. So they're making the choice to transition genders in the workplace. We have the structure in place to help walk them through that. From a partnership perspective, we work with communities such as we work within the community to also engage our LGBTQ community members in terms of getting screenings, in terms of participating in parades, and our team member engagement network supports that. So that's an example of how, from both the workplace, the people, and the partnerships, we try to bring all of those areas together. We also have to be very purposeful about the patient side of the equation. And in this area, we focus on 4 very specific things: data, education, language and communication, and patient experience. Without data, we would not understand who our patients are, and we wouldn't have the ability to recognize where we have gaps. Part of our mission is to make sure that our patient population mirrors our community, that our clinical trials participation mirrors our community. So we can purposefully collect race, ethnicity, gender data, sexual orientation and gender identity data, age, all of those things are collected. From an education perspective, our goal is to make sure our workforce is best prepared and equipped to respond to the unique needs of all of our patients and in the delivery of care. From a language and communication perspective, we provide language access support through interpreting and translation for our patients. And through patient experience, we monitor the data again to make sure that there's equity in there. Usually this is about the time that folks get a little overwhelmed and say, well, we're not ready for all of that. Tell us how we can get started. We're a small organization. We have small teams. We have no team at all. We have some very enthusiastic volunteers. So I'd like to spend the rest of my time walking you through a few steps that I think can help anyone in any industry get started on their journey. Again, I operate really to influence and create partnerships. I'm not a faculty member. I'm not a recruiter, but I am a great partnership builder, and that's one of the critical components we'll talk about today. So let's get started. So I'd like to start with exactly what I talked about us doing, which is starting with the data. I had the opportunity to participate in a talk not so long ago, and one thing that stuck with me that was shared was never have a fight that an Excel spreadsheet can solve. Data can help you to understand what your current state is. And so recognizing that there may be known gaps in your industry. If we think about the food service industry, there are well-known food deserts that exist where grocery stores and healthy foods are unavailable to our community members. And so just understanding what the gaps are. In technology, there's well-known gender gaps, underrepresented minorities. So consider what your industry is known to have gaps in. Be purposeful about collecting and disaggregating data. And when I say disaggregate, I mean right by gender, age, race, ethnicity. Could be about income. It could be a look at your workforce and trying to understand, where are you retaining team members? Where are you losing team members? What does your leadership representation look like? What does your governance structure look like? Is it representative of your community? Is it representative of your client base? For us, our baseline expectation is that our patients are representative of our community, that our workforce is representative of our community. So when we benchmark the data that we're collecting, we look to make sure that there's equity there. From a patient care perspective, the white community is the standard. And so we look at all other populations to see, is there equity in outcomes? Is there equity in access to care for all populations? And that's how we know that there isn't. Be purposeful about analyzing that data. Turn it upside down as many ways as you can. One of the things that we did recently after the unfortunate racial unrest that we continued to experience is we did a survey of our team members, and we were looking to see, are there concerns that we are unaware of? And what we learned in analyzing that data was that our team members are on board with diversity and inclusion. They understand the goal. They understand why we are pushing this. But what we also learned is that there are some cases where team members are afraid to speak freely. And it was by looking at the data from a different lens that we were able to explore the opportunities for psychological safety within our team members. So looking at your data in a number of different ways is important. Context matters. So not just looking at those numbers and making your decisions, but having conversations with your team members, clients as well, will help to add context as to, for example, why is psychological safety a concern for you? And then certainly generate some reports and findings, make sure that it's documented clearly so that you can move on to the next phase of your effort. Step 2, validation or revelation. So I always think it's great to celebrate those things that are going well. And if you look at your data and you realize, wow, there's great equity at certain levels, then absolutely celebrate that. But on the other hand, you might realize that you have revealed a concern, a gap, a barrier that exists. And that's when you have to make a decision about what your next step is. Doing some root cause analysis is very beneficial in this case. Organizations, you might often think, when you think about diversity and inclusion, you often think about the individual human interventions that may result in disparities, bias, discrimination, racism. Those things do exist, but also those things that exist within organizations are the organizational currents, the way we do business, the policies, the practices, the cultural norms, just those routine things that we do where we say, well, that's just the way we do it. And going through the root cause analysis will highlight those organizational norms that where if you create an intervention that can change the direction, improve a situation, here's your opportunity to do it. For organizations like Moffitt, where we say, yep, we're committed to inclusion, we're probably at the greatest risk of complacency and not looking closely. And so you have to be purposeful about exploring what is the norms within your organization and challenge them to say, are there different ways we can do things? When I joined the Moffitt Cancer Center, one of the first things that I noticed was we didn't have a supplier diversity program. So in my naivete, I went to our procurement team and I said, I think we need to do this. There's a great opportunity for us here. And they told me, well, we have this policy and it says that we encourage participation by all people, and we think that's all we need. And I was a little discouraged, and I said, okay. And I said, well, I guess I need to go back and get the data to make sure that that is indeed fact. And when we looked at the data, we learned that no, it wasn't. There were pockets of our community that were not participating. When we talked with business owners, we learned that they were not aware of the business opportunity. And as we dug deeper, we realized that although we said we were committed to doing it and making sure that our practices were inclusive, the fact was we never told anyone that there were business opportunities available. So a very simple thing that we were able to do was just put it on our website. And that started the conversation that allows us to now be, in the last 6 years or so, we've increased our spend with diverse vendors by 156%. It's not all just by posting it on the website, but that was where we started. So just an example of how currents can hinder your ability to move the needle with equity. So now you know that you have a challenge and a struggle, and maybe you're doing this all alone. And you don't have a team to help support you. So how do you get this work done? You have to build a team of allies. My team, and it seems like a lot, 23 people, 13 of those individuals are interpreters, and so they don't directly do equity work. So that shrinks the pool of people we have working on this. We operate using our engagement with our leadership, communicating with leaders, management, and team members at all levels of the organization, which was an improvement that we had to make because we realized that when we talked at the very senior level of the organization, and those who were at the entry level, just moving up the corporate ladder, were not engaged in the dialogue. So we had to make sure that everyone understood what our purpose was. Communicating how what you have learned impacts the business is critical to this conversation, and making sure that you have the support that you need, and inviting your allies and stakeholders to join you and have shared ownership. As we work on our plan for our support plan to Impact 2028, our goal is enterprise equity, that everybody has to be a part of the conversation. And if you want to go fast, you go alone. But if you want to go far, you go together. I see I have a question here, so I want to pause. What influence, thank you, Shelly Ann. What influence and impact does the center have as a leader in this space on others providing care in terms of D&I? So we are very open to sharing our knowledge. Just like we are in this forum, I belong to a number of different organizations that allow for newer healthcare organizations to tap into the resources that we have available. That's always something that we're willing to support. Thank you for the question. So after you've built your team, developing your strategy. On the right, I gave an example of a racial equity plan we developed, and it was a behemoth. But you don't have to go straight to something like this. You can start on a slow and small scale, evaluating your resources. Maybe there aren't a lot. Determining what the goals and timelines are, referring back to the data to explore what is the priority for your organization. Are there appropriate metrics and reporting to make sure that there is continued accountability? Oftentimes, ownership sits within the diversity team, but actually your collaborators who are at the actual decision makers, making sure that they're on board with owning this as well. Leadership has a critical component, and I reflect back on About 5 years ago, we made the decision that all leaders onboarding within the organization had to go through diversity and inclusion education as they start. And as they start within the Cancer Center, just as a baseline. And my colleague, Lee Green, and I, we went to the CEO and we said, we need to get this done. And we suggested maybe if we can get about 85% of our leaders, we would be satisfied with that. And he said, nope, we're going to get to 100%. And when I say leadership role, what happened was when we had probably about 30 to 40 stragglers, he picked up the phone and started making phone calls. He dispatched his chief person in charge, and she also followed up with those individuals, and we were able to get to the 100%. I couldn't have done it without that level of engagement and support. Recognizing that there are always opportunities to integrate inclusion work into other work that's being done. One of the ways that we've been able to move the needle, for example, on supplier diversity is the fact that it is integrated in, for example, our construction projects. That's one of the best ways we've been able to move the needle. We have integrated it into some accountability for our leaders as well. So that has helped us to move the needle. It's always important to recognize that there is a cost for not doing this work. And if consider whether it is okay, are you okay with certain team members not being retained at a certain level, that there may be dissatisfaction amongst your team, even a very small team. Our team members are valuable, and you definitely have to understand what drives their engagement. And then prioritize. Even for a team that, like mine, that is on the larger side, it's still a lot of work. And so we have to be careful not to take on so much that we can't get the work done. But I don't want to get lost that starting slow and small is okay. Making small incremental steps is absolutely okay and encouraged. Commit and lead by example. Going against organizational currents is not always an easy thing. And so if you're going to move in this direction, know that it will come with the need to have your leaders engaged and committed to challenging those organizational norms, building trust within the organization, and that comes through levels of accountability, transparency, making sure that it is a shared goal that the organization has, not just the diversity team over here is doing this work and everyone else is applauding on the sideline. Everybody has to be involved. Being okay with embracing the tension that might come with that. And when I say tension, I don't mean like aggression. I mean the tension perhaps between fair and equal. Fair not always the same. Sometimes the fair decision is not the equal decision. Equal doesn't always equate with fairness. And so that can create a tension. Also being purposeful about your own individual learning as well as learning with others. So I see a question here. I'm a part of an organization that recognizes it has work to do in terms of diversity, both with members and organizational leaders. Tips on how we can begin this process and not look forced and awkward. I think I would answer that by exactly where I started, and that is looking at the data. What have you shared the data? Have you shared what you have learned? And have you articulated what the impact of not moving in a direction to diversify your membership and your leadership would cause for your organization? It's about really being clear about what is driving your need to focus in that area and being able to continue to share that message. as often as people would be willing to listen. The last is about celebrating the incremental steps. I'm hopeful that I didn't come across that you have to do all of this work on a grand scale. It can sometimes it can sometimes um, become overwhelming, and it is important to, as you move through this journey, to celebrate those small steps. Is there a new partnership that you've been able to engage in? Is there a new leader that you have been able to onboard? Have you figured out a strategy that you're really excited about and you have the support to move it forward? Celebrate it. In 2012, we submitted an application to Diversity Inc., and I have to tell you, it was not responded to very favorably. But we made the decision to go through their application step by step and try to fill all of the gaps that we knew we had as an organization. And we came back again in 2016, and we were successful and we remain on the list until then. It is a lot of hard work. It does require continued focus, but it can be done incrementally. So we have a question. When there's tension between fair and equal, how do you recommending determining which path is the correct path? The path is going to be the one that, my personal recommendation would be the one that is best for what the organization is trying to achieve. And that may seem like a simplistic answer. So I read a recent article from Harvard Business Review, and in there they talked about women in technology and the disparity that exists there. And a professor that recognized that disparity, and she made the decision to have two classes. One class that addressed the needs of people of color and women, and one class that was largely males included in there, probably white males. At the end of the class, everyone was competitive. Were the two topics the same, discussed in the same way? Were the challenges the same? No, they weren't. They were not the same. They were not equal in nature. But at the end, everyone was able to successfully complete the class, and they were able to successfully compete for opportunities. I think there's oftentimes we don't recognize that not everyone starts and finishes you don't have the same starting line, but we're expected to have the same finishing line. And if we took the opportunity as an example to when we're evaluating someone for a position, we often say we'd like the best and brightest. But have we taken the opportunity to recognize that the candidate that may be, 2 paces short of your ideal candidate actually started 10 paces behind the starting line? And there's some really great exercises that illustrate that. And so it means we have to take a holistic view of candidates. Is it equal? No. Is it fair? Yes. And if your goal is to achieve equity and remove barriers, then that's an example of the type of decision you have to make. So to recap, always start with your data. It is your friend, even if it's very simple data about your workforce or your clients. Definitely disaggregating it. There's so much rich information that's lost when we don't look at our data by its different dimensions that it offers. Once you uncover disparities within the culture that are embedded in your culture, make the decision about whether you're going to act, but don't plan to act alone. Build a team, invite others who have decision-making opportunities to work with you, share with them what the priorities are and how they can improve your business. Formulate a plan, and it can be an incremental plan, starting really simply and ramping up over time. Moffitt Cancer Center started with a task force of people. There was no formal structure. It was a long time ago, but that's where we started. And that was the case for about 3 years until Dr. Green joined the team. And once you're in it, you have to commit and continue to lead by example, and certainly celebrate those incremental wins as you get there. I really appreciate the time we spent together today, and I'm hoping that there are maybe some further additional questions that I can answer for you about the 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 journey that we've been on, and perhaps starting and influencing diversity, equity, and inclusion in your respective industries.
Kathy, thank you so much. This has been great information, and we definitely do have some time for questions. So I appreciate you reserving a little bit of time at the end of your presentation, and I also appreciate the recap. I always love slide presentations that end with a recap of the 6 bullet points or whatever. So very helpful. I want to just make one comment about one of your comments you made is celebrate then continue. And I had a boss one time who had just a commitment to philosophy that no win is too small to celebrate. So
Absolutely.
it's those little wins that add up to the grand slam, if you want to use a baseball analogy, but no win is too small to celebrate. And while, I think as human beings, we tend to be impatient and we want to get to the finish line and, get it done now. Just being able to celebrate those small steps that lead us to that ultimate, desired result. So wanted to comment on that. So a couple questions related to, since a lot of the folks who are listening in are freelancers and they work, it's me, myself, and I, right? So they, may not have an organizational structure, but the reason we asked you to speak was certainly the concepts of diversity, equity, inclusion are relevant to all of us, regardless of size of our organization. So one thing you mentioned is about the data. Look at your data. Is data available, like publicly available? So if a freelancer or a sole proprietor or whatever wanted to look at the data as you suggest to be able to understand, even if it's just for themselves, why it's important, where can they get that data?
So from a healthcare perspective, it is publicly available data. The state of Florida, for example, collects cancer data. Um, the National American Cancer Society has data. So yes, so from that perspective, but most industries, if diversity and inclusion, if they recognize that there's a gap, there is data usually associated with the, the American Medical Association, or if there's some grocers association, or most of these organizations have data that is available. We were recruiting for some IT positions, and I just did a really quick Google, and I was able to Google search. I was able to pull up a ton of information on disparities in technology. It didn't take me long, but you just have to have the willingness to look for it.
Yeah, and boy, we do love Google, don't we? So you can get all kinds of information. Got to be careful, right? Can't believe everything you read on the internet, but there's some great resources out there. And I like your comment too about associations, because I think all of us, whether we're in, I'm in the public relations profession, and my association, Public Relations Society of America, has a very intentional effort now underway to raise diversity, equity, and inclusion. I'm also involved with an organization called Association of Fundraising Professionals, and likewise, they also have an effort. So it may just be you, but if you're a CPA or a lawyer or a salesperson, all of those occupations have statewide and national associations. So definitely touch base with them. So another question related to, you talked about the importance of supplier diversity. And I think that's something a lot of organizations may just totally overlook. They're focused certainly importantly on their employees and their, maybe their customers or their members or whatever, their clients or whatever, but don't think about the fact that, you need to have diversity among your suppliers. And for a sole practitioner, it may be, who they buy office products from, or supplies, or computers, or PCs, or software. Is there like a sort of a, I guess, use the phrase, showing how old I am, a good housekeeping seal of approval for suppliers and organizations that are really committed to diversity?
So there are organizations that certify suppliers as women women-owned, minority-owned, service-disabled veterans, veteran-owned, LGBTQ-owned businesses. There are certifying organizations that are out there. And when we think about the downstream impact of supporting diverse businesses within your community, for us, these are potential customers of ours. And so if we don't support businesses in our community, that means that they cannot insure people within the community. That means those families cannot pay to educate their children or live in safe communities. There's a downstream impact to supporting diverse suppliers.
Great. And again, just, overall, I know a commitment, it takes a real intentional effort to commit to diversity, equity, and inclusion. And I think certainly, I think we all recognize there's a tremendous amount of conversation, social media, mainstream media, and otherwise these days. So you do see a lot of organizations and corporations that are, speaking out on this issue. But I think, one of the things that came up in the D&I panel earlier today is just you got a lot of companies that are talking, but are they walking the talk? And I think that's so important. And certainly Moffitt is an example. I appreciated the comment earlier about how can you in the healthcare space help lead others in that same space. And I think it just, to me, my comment back was, Moffitt is an organization, and again, I'm right here in the Tampa Bay area, right? So I know Moffitt very well, but Moffitt is not only an awesome hospital to take care of folks who have cancer and do a lot of tremendous research on the prevention side. Their operations as it relates to DE&I are also, top line, and you've been recognized as such. And so I think others can learn from that as well.
Yeah, absolutely. But I don't want to discount that you can absolutely start small. It doesn't have to be big. It could be recognizing holidays for your team members. As a sole proprietor, it's often about also asking questions. Are you asking the questions of those other organizations that you work with? Are you saying purposefully, I see you've presented these ideas. Have you made sure that you've been inclusive in selecting these folks for us to work with? Are these folks representative of our community? So I think there's asking the questions to lead your collaborators to think with a lens of inclusion is a really value added opportunity.
And if you think about the fact that a lot of us as freelancers or sole practitioners or consultants are working for organizations, we have clients, and there's a greater expectation, I think, among those clients. And I think if we don't think about this as we're, let's say, pitching business, or sending out a proposal to prospective clients, I think it could be a real disadvantage for us. I'm not just saying, put it in there, make it a line item or a bullet in your proposal, but really committing to it. And I think that expectation is there. So it's changing, I think, what we as consultants and sole practitioners need to bring to the table when we're hoping that somebody will hire us on a contract basis.
Yeah, absolutely. And for larger organizations like Moffitt or others who, if you think about from a supplier diversity perspective, we look for partners who can help us achieve our goal through second tier spend, if for example. So if a sole proprietor or a freelancer came and say, hey, I have a partnering organization that I'm going to work with that can help you to achieve your goals, that we absolutely look at favorably, and it absolutely does set you apart from some competing organizations that may not have the ability to help support those goals.
Yeah, absolutely. So I don't see any more comments or questions. So Kathy, I'm just going to ask you if you want to, any closing comments you might wish to make and words of wisdom. Again, certainly it's been wonderful having you with us today. And I know you're going to be speaking at another event with our Public Relations Society coming up next month, and looking forward to that as well. But any closing words of wisdom before we end the broadcast and allow the next group to get set up?
So I really would like to thank everyone for their attention and just encourage, continue to learn about those inequities that exist within our community and ways that you can individually help to close those gaps. As I said earlier, in response to the question that was posed, we're certainly a resource to our communities, and I speak with people all over the country about the work that we're doing. So I am not opposed to providing some guidance if it is desired. Thank you again, and hopefully everyone has a wonderful day.
Well, thanks again, Kathy. We sure appreciate it. And thanks all of you for tuning in and for your comments and your questions, and lots of great comments today that were shared. And we encourage you to, again, keep the conversation going. We've got some other mechanisms, and you'll see coming through our social channels and follow up some ways to stay involved in this conversation. And certainly feel free to share Kathy's presentation when the replay link comes up and is available on the website. Feel free to share that. And again, think of this as an opportunity. If you have some folks, and maybe it's your boss or colleagues or whatever, who just aren't quite sold on the idea of how important this is, let them watch Kathy's presentation and share some of this information, and maybe just take those 6 steps that she offered up. And that might be the starting point for your organization or your association, or for dealing and working with your clientele. So thank you all very much. Again, make sure you give Kathy an upvote on her presentation, and share it on Facebook, LinkedIn, Instagram, whatever your preferred social channel would be. Thanks very much for joining us for this wonderful presentation on this Freelance Business Week Tampa, and we hope you'll join us for the rest of the conference. Bye now.